My name is Janet Lykins, and I taught at Russell Independent Schools, and I taught for 32 years. We would get up every morning to walk, and we always walked 2 or 3 miles. Well, it got to the point that I'd say, can't do that third one. I'm going to go on home. And he'd say, oh, no, that's fine. Well, then I guess we walked a little bit more, a few times, and I said, I can't do a second one. And that's when he said, there's something wrong. When's your doctor's appointment? So when I went in, she looked at me and she goes, Janet, you're just tired. And I said, I am tired, but I'm not, it's normal. I'm not any tireder than what I normally am. And then we started talking about Brent coming across, my husband coming across this calcium score test that he had read about, and he had his done. And when he had his done, it was 150. So, of course, he had to see a cardiologist, and they put him on a statin. And she said, I really think you need to have that calcium score done like Brent did. Maybe there's something to this. And if not, then, hey, what's the big deal? It's not a big deal at all. You lay on a table, and put your legs up with a little cushion, and it's 5 minutes and you're done. We were out walking the morning that the results came in to my doctor's office, and her nurse, who was also one of my previous kindergartners, I could hear her voice shaking. And I said, Jenny, what's wrong? And she went, Janet, we've got your calcium score. And I said, okay, well, what is it? She said, 550. And I went, oh. So then, of course, they called, set me up with a cardiologist, and he immediately just said, we need to do a heart cath. When he's doing the heart cath, of course, you're awake, and I'm not seeing any movement on the screen. And I went, ooh, this doesn't look good. He went, it's not. And I said, you're going to stop, aren't you? And he said, yes, we are. And I did finally go see the cardiologist, and we were talking. He said, you really, after, he went in and did the heart cath, he said, you literally could have just fallen over dead because you had so many blockages. The surgery went like clockwork, I think. As soon as I got out of surgery, I believe I was up and just walking at that point, wasn't I? I had zero pain, which the nurses kept saying, Dr. Bronstein says that you need something for pain. I said, but you don't understand. I don't have any pain. Nothing hurts. I'm a little sore, but nothing hurts. I started walking after I went home. They said it would be a good idea for me to do that. So we started walking just on level ground outside. I do enjoy the rehab. We've got a great group of people that, they really monitor you. And after I had my calcium score done, and then, of course, I had open heart surgery, and people would come by to, talk or whatever. It's like everybody that, came in to talk, they had, they were going to have the calcium score done because I think when they look at you and they see that you're small, you try to eat right, you're out there walking and exercising, and they think, my gosh, if this can happen to her, it can happen to me. If you're tired all the time, I did not have tightness of the chest. I didn't have any, palpitations or anything like that. I was just really tired, and you can't ignore that. You know your body, or you should know your body, and you need to be proactive